know that every year the common cancer leukemia kills more children than any other cancer? Or that a bone marrow transplant can save the life of someone battling leukemia, lymphoma, and other blood cancers? How about that anyone just like you can help save those suffering and in desperate need? Today, I'm going to discuss what exactly a bone marrow transplant is, a few common myths pertaining donating blood marrow, and how taking one simple step can lead to a life-changing experience. First, let's discuss what bone marrow is and how it is used to treat diseases. According to the National Cancer Institute, bone marrow is a soft, spongy-like tissue located in the center of a bone. It produces white blood cells, red blood cells, and platelets. Bone marrow can be used to replace non-functioning bone marrow with healthy, functioning bone marrow of those suffering from a variety of blood diseases. Now, I could spend this entire speech going on and on about what bone marrow is and all the different diseases it can help fight against. But there is truly no other way to better understand this process than to tell you a story from someone that has personally been helped by an anonymous bone marrow donation. This is a story posted to the Be The Match website about a little girl named Clara. Clara was just 4 months old when she was diagnosed with acute myeloid leukemia. Clara's chances of survival were very slim, as her specific form of cancer was high risk due to an infection. However, because of an anonymous bone marrow donation, they were able to find a 10 out of 10 match, and she was able to not only successfully receive the transplant, but also be discharged from the hospital 100 plus days earlier than any patient has ever been discharged. All thanks to a bone marrow transplant donated by a stranger, just like you. This selfless act gave a mom another chance to sing her baby to sleep at night, gave a dad another chance to take his baby girl to a daddy-daughter dance, gave a little sister another chance to grow up with a forever best friend. Thanks to a noble individual, this family was gifted the best gift one could ever receive, a second chance. This heroic person could be you. Health Resources and Services Administration states that each year, nearly 17,500 people ages 0 to 74 years old in the United States are diagnosed with life-threatening illnesses where a bone marrow transplant from a related or unrelated match donor is their best treatment option. Now let's talk about some common myths regarding bone marrow donations. The first myth I'm going to discuss is that the best chance for a match is to receive bone marrow from a family member. Though tissue type is inherited and many believe that a family member would be matched, it is actually found that only 30% of patients match with a relative, while the other 70% rely on others, like us, to donate. Another myth many find true is that there is a limited pool on who can donate. This is false, as the need for bone marrow is growing. Donors of different ethnicities are especially needed. The more diverse the bone marrow, the more patients can reap the benefits. In fact, patients are most likely to match someone of the same race. DoSomething.org states that the likelihood of finding a donor is estimated at 66% for African American patients, 72% for Hispanic or Latinos, 73% for Asian and Pacific Islanders, 82% for American Indian and Alaska Natives, and 93% for white patients. The last myth I'm going to discuss is that donating bone marrow is a complicated and painful experience. Aside from common myth, donating bone marrow is super simple and can be painless. Matter of fact, many bone marrow donations are performed surgically. The donor is given anesthesia to prevent feeling any pain during the procedure. According to the National Marrow Donor Program, the typical hospital stay for after a marrow donation is early morning to late afternoon. Now, you may ask, what is the simple step you keep talking about? Becoming a part of the bone marrow registry is as simple as swabbing your cheek. That's right. When you join the registry at bethematch.org, you will receive a cheek swab kit. Once you send in your cheek swab, your tissue type will be tested. If your tissue type is a match for a patient, then you will be asked to come in and go through the donation process I mentioned earlier. That's all it takes to become a part of this life-saving community. If you're still contemplating joining such a rewarding team, put yourself in the shoes of a parent with a sick child, unable to give them what they need, but knowing that someone out in this world has a tissue match that could save your child's life. Feeling helpless as you watch your child suffer from a disease that is slowly taking them away from you. These individuals are desperate to find people like you, healthy and capable of donating bone marrow to save their child's life. You can be the reason a child gets to play their favorite sport they've always wanted to play, but have been too sick to participate in. The reason a child gets to have a sleepover like a normal kid. You can be the reason someone sees another day just by swabbing your cheek. Be the change, save a life, give a second chance, join the Bone Marrow Registry. Thank you. Yay!